Let's today talk about the rotator cuff muscles. Why these are called rotator cuff? These are called the rotator cuff muscle because they form a musculotendinous cuff around the shoulder joint or the glenohumeral joint. Now, what are the muscles groups involved? The muscle groups are remembered by the mnemonic SITS. SIT stands for SITS and it stands for supraspinatus muscle, supraspinatus, infraspinatus, Teres Minor, and the last one is Subscapularis. Now, talking about the stabilization of the joint, how these muscles or how the rotator cuff muscle is involved in the stabilization of glenohumeral joint. This muscle group forms a musculotendinous cuff. Now, this musculotendinous cuff blends with the fibrous capsule of the shoulder joint and reinforces and supports this fibrous capsule. Tonic contractions of this cuff is responsible for holding the humeral head in the glenoid cavity. Now, talking about their function and how they're tested, the supraspinatus muscles. The supraspinatus muscle is supplied by the suprascapular nerve. It is majorly involved in moving the arm, helping the deltoid muscle in abduction. It is tested by palpating the spine of the scapula, palpation of the spine of the scapula during abduction of the arm after fully adducted arm. First, we will fully adduct the arm and then we will undergo abduction of the arm. Now, talking about infraspinatus muscle. The infraspinatus muscle, it is again supplied by the suprascapular nerve and is tested by palpation of the spine of the scapula. But the movements are changed. We now we would flex and adduction of the elbow joint and then lateral rotation of the arm. First adduction and flexion and then lateral rotation of the arm. Now talking about the subscapularis muscle, because teres minor cannot be palpated separately because it is also involved in the lateral rotation of the arm. The subscapularis muscle is the primary muscles that is the medial rotator of the arm, also involved in adduction of the arm and helps to stabilize, holds the joint in place during movement of elbow, shoulder and hand. That's all for rotator cuff muscles.